right. Hello, Dr. Lauren Tober. It is so great to see you.
Thank you so much for having me here, Karen.
I'm excited. This is, kind of a first for me to have someone on with your background, and you're also a yoga teacher. So I think you're going
Mhm.
to bring just particular insight and discoveries for the listener. So I'm really excited
Glad
to
so.
kick this off. So why don't we start? Why don't you tell us where you are in the world? Because I think that's kind of interest.
hmm Sure. So I live in a small town called Mullumbimby, which is in Australia. It's near Byron Bay. So people in the yoga world that have maybe been to Australia have probably been to Byron Bay. It's honestly one of my favorite places in the world.
Yeah.
And yeah, I feel like really delighted to be living here.
That is awesome. Yes, I have heard of it. I've never been, but it's on my bucket list for sure.
Highly recommend
Cool.
it.
So why don't we kick it off by having you share. Really, you can take this wherever you'd like. I'd love to kind of hear a little bit about your background and
Mm.
especially how you sort of added this other component of teaching yoga to your, sort of
Mm.
long
Oh,
experience in psychology. So I'll just kick that off there and then I'm psyched to hear what you have to say.
cool. All right. So I'm trained both as a clinical psychologist and as a yoga teacher. And really, they developed side by side, although they were very separate for a long time. But, I studied here in Australia, and then I went as an exchange student to UBC in Vancouver. And that's where I found yoga. So I got into yoga in Canada. And then I came back to Australia and I was finishing off my studies, and I was both studying to be a psychologist and practicing yoga. And then when I finished my psychology studies and became a psychologist, I wasn't, to be honest, really sure that I wanted to be a psychologist. I didn't feel like I knew enough about the world and the psyche and myself to really be able to help anybody. It felt like a big responsibility. And I was really into yoga. So actually, what I did after I finished my studies was I moved to London. I met a guy. I fell in love. He was in London, so I moved to London, and it was in London that I started my yoga teacher training course in Ashtanga yoga. I did an internship there, and then my boyfriend, my husband now, we decided we'd leave London and go traveling. And a big part of that traveling was spending 9 months in India. And we both studied yoga for that time. And then we nearly stayed in India. We nearly didn't come home. It was kind of this sliding doors moment. And I sometimes think, oh my goodness, what would our life be like if we decided to stay there? But we didn't. We came back to Australia, and that's when I started a doctorate in clinical psychology. Um, and yeah, I really wanted to study yoga, for like yoga and mental health for my doctoral program. But I didn't really have the support of the university to do that. It was like the Australian National University, which is kind of a conservative university here in Australia. And yeah, they were willing to let me study it, but nobody knew anything about yoga. They didn't even know my supervisor didn't even know how to spell it. And so in the end, I decided to study what is called mindfulness-based cognitive therapy, which is based on the mindfulness-based stress reduction program, which really is just yoga. Really, it's yoga, but they don't call it that. It comes under the kind of mindfulness banner. And when I was doing this, which was nearly 20 years ago when I started, maybe 18 years ago when I started, mindfulness was just coming into psychology then. So that was much more accepted. I had the support of the university, and that's what I researched, mindfulness for recurrent and comorbid depression and anxiety. And so I worked as a psychologist over here, and I taught yoga. So my husband and I were teaching Ashtanga yoga at the time in Canberra, but they were very separate. I was kind of doing my research in the middle. And then when I was pregnant with my son, who's now 16, which is amazing, we moved up to this area, and there's so much yoga and stuff going on here. And then, my world slowly started to come together, and now they're really, really integrated. So I run this yoga psychology institute where I teach yoga teachers about mental health, and I teach health professionals about how to bring yoga into their therapy work. Yeah, and we offer different programs and courses up here.
Hmm. Yeah, that's interesting. I was thinking when you were talking about mindfulness, living in Boston, right down the street from Mass General, is the home of John Kabat-Zinn
Of
and that
course it is.
entire
Yeah. Yeah.
framework. So I can totally relate. Matter of fact,
Mm.
I practiced yoga for years with his daughter because we went to
I
the
did.
yeah, in Cambridge. So
He's
my
done a lot for the world of bringing like mindfulness and yoga together with psychology, I feel
Oh,
like.
absolutely. Absolutely. Yeah. So I'm curious, I was sharing with you before the show that part of my background is in working with people in sort of not clinical psychology, but sort of the psychosocial aspects of disability. I worked as a social
Hmm.
worker, rehab counselor, but
Fantastic.
when I'm teaching yoga,
Hmm.
even though I'm aware of the work I used to do and the aspects of that, I am looking at my role as a yoga teacher
Hmm.
from a professional scope of practice as being somewhat limited with respect to addressing mental health problems or concerns in my students.
Hmm.
However, I know, of course, that all of us, as we're teaching our classes, we have students in our classes that are managing
Yeah.
lots of different things, right? We can
Yeah.
look at it through the clinical lens, we can just look at it conversationally. So tell me a little bit about when you talk about the institute that you run and how you work with yoga teachers. Tell me a little
Hmm.
bit about that. Like, what are you training teachers to do
Yeah.
with this information, with the skill set, with the knowledge?
I love that you brought up scope of practice. I think that's a really important piece of it, that we understand our scope of practice as a yoga teacher and what we're offering. So, um, so just to take a step back, you talked about how many people are coming to yoga for mental health reasons, and there's likely to be students in your classes who are going through stuff, and the research really supports that. There was some research that came out of Australia quite a few years ago now, but it's probably even more relevant than then. Stephen Penman, found that nearly 50% of yoga students reported that one of the reasons that they were starting yoga was for mental health reasons, and nearly 80%, it's like 79.4 or something like that, of people continue to practice for the mental health benefits. So you're 100% spot on. People are coming to yoga
Mm,
for mental health reasons. And so I just think it's so important that as yoga teachers, we have an understanding of mental health, because it's probably safe to say that the majority of our students are practicing for many reasons, but one of them will be support with depression or anxiety or stress, or, just dealing with the challenges of life that we all deal with. So I just think it's so important that yoga teachers have an understanding of mental health and understand what we can do to help and reduce the likelihood of harm when it comes to mental health in our yoga classes. So, as to what we teach in mental health aware yoga, there is kind of six main parts of it. The first part, or the first pillar, is around Western psychology. So, it's about understanding mental health through a Western psychology lens. And some people are really into this. And I think more and more we're understanding there's less stigma, and we're understanding more about mental health. When I first started teaching this, I had a lot of people saying, well, I don't want to be put in a box. I don't want to put people in boxes. I reject this kind of the Western psychology lens of mental health. But I've noticed over the past maybe 5 years that that's becoming less and less, and people are much more interested in, would I meet diagnostic criteria for one of these, and not using it as a way to put themselves in a box, but a way to understand. And so I think it's helpful for yoga teachers to understand these boxes or these diagnostic labels that their students might be getting if they go to a psychologist or a psychiatrist or a DP. So they're speaking the same language. So if a student comes in and says, well, I've been diagnosed with social anxiety disorder or major depressive disorder, they'll have an understanding of what that means. So scope of practice, it's not about diagnosing at all, but about understanding and being able to speak the language of your students and other kind of health professionals, because yoga teachers can be part of a team of health professionals. And to be able to speak that language is really, really important.
Mm-hmm.
And so then the second pillar is around yogic psychology. So it's around looking at looking at mental health through the lens of yoga. So what did Patanjali have to say about mental health? And so we look at the yamas and the niyamas, and we look at the koshas and the gunas and the way that this relates to mental health. And then we look at how do we create a safe container? And so this is something that generally I think as yoga teachers we do so well. We create these beautiful, supportive, compassionate, non-judgmental spaces where our students can come and be themselves, to show up as their full self and be accepted just as they are. So, there's many different ways that we can do that, very practical ways about the way that we set up the room, and do we burn incense or not, and do we lock the door or not, or, there's so many different kind of subtleties in the way that we set up our spaces and the way that we show up for our students that can support them to feel more likely to feel safe in the class. We can never make a space 100% safe. We talk about this idea of a safe container, but we can never make anything 100% safe because we never know what people have been experiencing, right? But what we can do is do the best that we can where they're more likely to feel safe. We also within the safe containers, we look at the ethics of being a yoga teacher, which I think is really important. And then the fourth pillar is around therapeutic skills. So, if you're not a therapist, yoga is not therapy, but there are some things that we can do to, make to support yoga to be therapeutic. So it's things like the language that we use and the way, like the rhythms of a yoga class, different things that we can do to support, um, the way that we listen to our students, that we can set up a space that is more likely to be therapeutic. And again, like you mentioned, we're staying within the scope of practice. It's not about offering therapy unless you're also a therapist, and more yoga teachers are also therapists as well, which really excites me, because that was kind of the pathway that I went down. And when I started doing this, I didn't know anybody who was bringing these worlds together, and now there's more and more like yourself, more and more social workers and counselors and occupational therapists and physiotherapists and doctors and psychiatrists who are getting into yoga and looking at bringing these worlds together. Okay, so we talked about Western psychology, yoga psychology, creating a safe container, and therapeutic skills. And the sixth pillar is around yogic practices. And this is often the pillar that most people think about, most yoga teachers or most yoga students will think about when they think about yoga for mental health, is what practices can I do to support my mental health? And we go into a lot of detail in the trainings around this, but really it's only one part of it, right? All these other things that I've spoken about, the safe container and the therapeutic skills and understanding yogic psychology, is a really big part of it. Yes, the practices can make a big difference, but the way that we hold space for our students, the way that we show up for ourselves and each other, really, to me, like that's a big part of of how yoga can be really supportive from a therapeutic level.
Mm.
If we come to a place where we feel seen and heard and welcomed and safe, like there's such magic in that.
Mm. Yeah, when you were talking about the teachers who have, like yourself, both a clinical psychology background and our yoga teachers, I was thinking even primary care physicians, if they had yoga in their training, wouldn't it totally be amazing to think about going to your PCP and getting prescribed deep breathing exercises and mindfulness
Yes.
exercises,
Yes.
maybe even before whatever medication, or in addition to, or even just an acknowledgement that these other practices exist and can positively impact your health. So,
Yeah.
yeah, certainly, maybe as we progress into medicine 3.0, these things will become maybe more common.
Yeah.
So, I love, and I did see when I looked at, and I want to talk about your book because I want the listener to know that a lot of what you're speaking of is in your book. So I want to take a moment to, number one, acknowledge that. And number two, as we talk about these concepts, let the listener know this is not just a once and done. As you're listening to this, if it's really resonating with you, get the book, and we'll talk about the book and the title and how to get it, of course. So when I was looking at the table of contents, I saw these pillars. So when you were
Yeah.
speaking to them, I was like, okay, now I see how this is all threading together. So what I'd
Mm,
love to do is I'd love to talk a little bit more about some of these. And I'll just sort of throw something out there, not having had a lot of exposure to your methodology. One of the things that stood out to me was this idea of a safe space.
mm,
And
mhm,
one of the reasons it did is because I feel like, I mean, I've been teaching for 22 years. So I've had this trajectory where I've seen things come and go, and I've seen trends come and go, and I see languaging around teaching sort of evolve and things like that. And this idea of a safe space has sort of been a common theme. But
mhm,
I feel like yoga teachers are really good at speaking in esoteric terms and not always
uh-huh.
making things clear. And for new yoga teachers, it becomes very problematic. And a lot of the work I do is with new yoga teachers. And so they hear these esoteric terms and phrases, and they're looking for, well, how do I make that happen? Like if I hear from a senior teacher, teach what the students want, what does that actually mean? Right? So when we talk about a safe space, let's talk about what that is. So
Mhm,
I'll just kind of toss that out to you. And, I'd love to know for someone listening, and even for myself, quite frankly, what are the elements of that and what are they tied to that's grounded in psychology?
mhm. Yeah, so one of the things that you kind of spoke to is around meeting your students where they are. And so for some students, maybe like it works, all this flowery, like esoteric language. If you live in Byron Bay, that's probably the kind of normal language that people are used to around here. But if you're teaching in a place where that isn't the way that people are speaking, or you're going into an office, or you're going into a hospital or a community center, um, it's not going to be language that's going to resonate for people, and you're going to turn them off yoga, or they'll be confused. They'll be like, what is this? What are they talking about? I don't get it. I'm not coming back. Or this lady's off with the fairies. Like, I'm not coming back to this class. So, really, we want to teach in a way that meets the needs of the student in front of us. It's around really thinking about what's going to work for these students. And if you're teaching teenagers versus if you're teaching seniors, or if you're teaching in a corporate environment versus if you're teaching on a retreat in Bali, thinking about how can I adapt the language that's going to be the most accessible and powerful and supportive for the students in front of me. And so there may be a time and a place for esoteric language, but there also may be a time and a place for very clear, simple, straight to the point
Mm.
language. And that's going to depend on a lot of different factors.
Yeah. I mean, one of the things that's coming up for me as I'm hearing you, and, I focus a lot of the work that I do on helping yoga teachers understand anatomy in the context of how do I understand anatomy, the fundamentals, so that I can confidently share it in my cues and sequences.
Yes.
And when I think about some cues, like don't put your foot on your knee in tree, there's like that warning. And so there's that implicit, if I say that as a teacher, I'm giving
Mhm.
a warning to my students that something bad will happen if their foot is on their knee when they're in tree pose. And I don't want to go into all of the potential
Yeah.
rationale if that's legitimate or not. But I was
Mhm.
thinking about that when you were talking and explaining safe space, and my mind went to, well, if I want to create a safe space, which no one's going to disregard that or disagree with that,
Right.
what are the elements of an unsafe space? What
Mhm.
becomes maybe universally unsafe for people, or what kinds of things come up to you? Because
Mhm.
I sort of feel like somebody listening might, I mean, the intention behind something is an important component, whether
Yeah.
you're sharing your cue or setting up the room. So maybe somebody listening doesn't know what are we trying to protect people from, and could I maybe unknowingly be doing something that is
Mhm.
unsafe because I don't have training in clinical psychology. So what are we, what, I mean, I sort of know a sense, but I really want you to share this. And I could be way off. So educate me.
Yeah, so one of the really important things is to be predictable. So if you think about what is unsafe, being unpredictable is something that might feel unsafe. And so being predictable then can kind of if kind of filter out into so many different areas. So that might mean so your students know what to expect. They're not getting surprises. So it could start from the very start in the things that you put on your website and the way that you describe a class, for example. So the class description is like an accurate representation of what's going to happen in class, for example. So if you're teaching a quite dynamic vinyasa that has some postures or practices in there that you would need to have worked up to over a series of months or years, then you wouldn't put suitable for everybody in your class, because then they will come in and they'll think, yeah, this is suitable for beginners, and it won't be. And then they could feel really unsafe, both physically, but also I'm not welcome in this space. So if you're teaching things in a way that you said it's suitable for everybody, but then it isn't, it has both the physical implications, but also that feeling of not really being in the place that I'm supposed to be and not being welcomed. And that doesn't feel good for any of us, but particularly if we're going through depression or anxiety, or we have a history of trauma, we can be particularly kind of tuned into or noticing places where we don't feel welcome, and we can feel particularly put off balance by something like that. So being from the very start, being clear. And then as students come in, it can be very helpful to be predictable between classes as well. So students are knowing what to expect. You're welcoming when they come in, your mat goes there, they know where to put their mats, they know where to grab the props. um, they learn to know what's going to happen in the classes. And so when we show up, that can help our nervous system to feel more regulated, to feel safe, because we know what's coming. I don't know if you remember, because it was such a long time ago, when you went to your first yoga class, or maybe you go to a new style. Like the first time you go to a yoga class, it's all new. It's a new space. People are talking a different kind of language in many ways. Even if you're not using Sanskrit, there's all this like new jargony type stuff. People are dressed in a certain way. There's unspoken rules, like don't step on people's yoga mats, spray your mats at the end. Like there's all these rules that we take, unspoken rules that we kind of take for granted because we've been doing it a long time. And so being predictable, help we can either explicitly say it to new students, which I think is really important, but then there's this predictability between classes. So students' nervous systems can settle and they know what's going to happen. If
Mm.
we're offering things like touch, which if you're working with anatomy, maybe that's something that you're doing in your classes, we need to be very predictable around touch as well, and not to mention all the stuff around consent and appropriate touch as well, but having this predictability in the way that we touch, predictability in the language that we use. If there's a new teacher coming in, like you're sick, for example, and there's a new teacher, you need to let students know in advance that that's going to happen. For many students, they won't mind. It'll be, I don't care, I get to do the class. For some students, that will be a real shock to the system to have a different teacher there, and they need to know that in advance, and they might not choose to come. It might
Let
be
me
that
just
they don't
let me
know.
just interrupt you for
Yeah,
a sec on that point,
yeah.
because I so want to capture what you're talking about and just expand on it a little bit, because
Please do.
your perspective that you just shared Oh my goodness, is such gold. I had literally this conversation today with a teacher
Uh-huh.
who shared that she had to do some emergency covering for another
Mhm.
teacher. And
Yeah.
she's noticed that a number of the students have been canceling, and
Mm.
she's taking it really personally. And I
Mhm.
shared with her a story from my past when I had to emergency cover. And a woman walked in. She saw me standing at the desk. She asked the front desk person, "Why is she here?" And
Mhm.
she said, "So and so had an emergency. She was willing to cover." And the woman hightailed it out.
Yeah.
And in that moment, I took it to heart. But as I rethought it,
Yeah.
I thought of what you're talking about. So I just wanted to make that connection because so many times yoga teachers make it about them. But what
Yeah.
you're saying, and this is sort of human nature, we make these things about us.
Mhm.
But in what you're saying, it's really about the person's perception and reaction and even nervous system's ability. So just talk a little bit more about that.
Yeah, I mean, it might be about you. They've been to your class and they didn't like it, but even then, it's not really about you. It's about their preference, right? So even if it is about you, it's not about you. It's about their preference. And like you're saying, it might actually be nothing to do with you. They like this teacher, they like this class, or maybe they simply they're familiar with it. It feels safe. And so, yeah, they only want to go to a class where they feel safe. Fair enough. I went to a class recently with a teacher. It actually was the same teacher, but he keeps changing the way that he teaches. Sometimes it's really gentle, sometimes it's really dynamic. You never know what you're going to get. And I was kind of rolling with it, but thinking, yeah, I want to choose the class based on what I'm needing on that day. And then in this class, he put this really loud, kind of felt like I was in a nightclub music. Usually it's this kind of background music, and this was like pumping, pumping. And I thought my nervous system felt so dysregulated by this. I was like, this is not why I'm here for yoga. And, usually years ago, I just would have sucked it up and stayed because I wouldn't want to offend him. But actually, what I did is I rolled up my mat and I left. And it wasn't because I didn't like his class. I was really enjoying his class, but the music was not working for my nervous system. And so I thought, that's not why I'm here. And I walked out. And um, yeah, because it didn't have this predictability. If I'd known the music was going to be that loud, I would have went to a different class. Some people love music that loud. I actually don't have a problem with it. But there was not this predictability of this is not what I signed up for, and I got something else.
Yeah, and I think what you're describing is what so many yoga teachers miss when they take these things to heart. I mean, so many
Mm.
yoga teachers tell me the thought of somebody leaving their class just strikes fear in them because
Yeah,
the
that's
obvious
opposite.
assumption is that it's about them.
Yeah.
And yet, what you're describing to me, when I hear you describing it, it says to me, you have agency over your body, your mind,
Yeah.
what you want to do, and you are exercising that agency as you
Yeah.
should. And it's
Agreed.
sort of detached. I mean, of course, the catalyst is the music, which he's playing, but it's not
Mhm.
like you dislike him and you'd probably even go to another class of his. It's your, so again, I didn't know we were going to end up here, but I think these examples will hopefully give teachers listening who may be triggered by these scenarios an
Yeah.
opportunity to reframe them and in a way have sort of almost like a therapist, like a healthy detachment from the person and to
Mhm.
be able to see the situation in a way where you're not making it a story about you.
Yeah. Yeah.
So I'm really glad that, yeah. So
Yeah.
the,
I mean,
go ahead.
I find it really helpful. Like if something like that happens to me, I'm on the receiving end of that, whether it's some
Happened
explicit
to me.
feedback or somebody walks out, then I find what's really helpful is to think about, okay, what part of this is mine and what part of this is not mine. And um, sometimes there is something that we can look at, like this teacher, an example, like if he did this process, then perhaps he could think about the music and but the fact that it doesn't work for my nervous system is not on him. Like that's my part of it, and that I have the agency to walk. It's not easy to walk out of a class. Like it was very difficult for me to do that. I was all sorts of processes going in my head for for me to do that, but ultimately I chose what was right for me, and it was about me. And somebody else, like probably maybe everybody else in the room was loving that class. And so to do this exercise of what part of this is mine and what part of it is not mine, is theirs, I think can be really helpful, because sometimes there's some gems that we need to take from it. But most of the time there's a good part of it that isn't, and we can let that go as
Mhm.
well.
Yeah. I have a scenario I'd love to run by you, and
Okay.
I wasn't thinking of this until this conversation right now, but I think it does sort of touch on, um, and it might be the sort of thing that if someone had a background like yourself in clinical psychology, they might be able to see this kind of behavior as through the lens of why might someone do this. So the other scenario that I hear sometimes, and this also fits in with this safe space concept, is students who come to the class and set up in the front and do their own practice. So they're doing something very different. I've
Mm-hmm.
also had students in the center of the room
Mm-hmm.
and just very much doing their own practice. I used to have a couple, they used to come together and they used to come early and put themselves right in the center. And
Mm-hmm.
everything they were doing was completely different. And so I can look at that sort of through the lens of psychology and look at it and maybe wonder what's
Mm-hmm.
really the draw for this person, or is that just an assumption and it's really just about I'm happy to be here and I choose to have agency over what I'm doing and do my own practice. I also see it though from the point of view of the teacher and creating a safe space for everyone
Mm-hmm.
doesn't include distractions. And I also wonder, is there a compromise where maybe the students can do their own thing and not be potentially distracting for other people? So I'm giving you a lot to sort of work with here.
Mm-hmm.
Again, this is just coming up spontaneously. I don't know if you would consider that either detracting from a safe space conceptually or not. So I would just love to hear what you think.
So help me to understand. So are they just coming and doing something completely different, or are
I
they kind
mean,
of adapting what you're teaching? Like you're
oh, I've
teaching.
had people do, and I've heard from teachers totally different. Matter of fact, I worked in a studio for a while and they supported that. So people would come and they would typically say, I'm just going to be in the back doing my own thing.
Okay.
So it was really their own thing.
Okay, so the answer that I often give when people ask questions like this is it depends. And I know
Yeah,
that's a little
no,
bit
I
of a
totally get
frustrating
that.
answer,
That's
but
why I,
let's kind of pull it apart a little bit.
yeah.
I'm a big fan of supporting your students to create an individualized practice. I think that's really important. It helps foster this sense of agency that we were talking about before. I have autonomy over my own body. I listen to what my body needs and I practice in a way that works for that. So I think both from a physical injury prevention perspective, it's important, but also in terms of a mental health, cultivating agency and empowerment, and also kind of an embodiment, listening to what my body needs and acting on that. Like there's so many layers about why I think that's really, really important. And so I would really encourage teachers to support students to practice in that way. But you're talking about something different. You're talking about somebody coming in and just doing something completely different than what you're teaching.
And also positioned such that
Yeah.
other people can clearly see them.
Yeah, and I think I've never had this experience, except, when I was teaching Ashtanga yoga many years ago, we had a Mysore style class. So, but that was the design of the class. So if we're coming back to this idea of predictability, that was what we were expecting. People were coming and they were doing their own practice, although everybody was doing an Ashtanga Series 1 practice, but with adjustments. And that was what was expected, and so that was appropriate in that context. I had people ask me this question, like I've had this question quite a bit. If I encourage an individualized practice, will students just come and do their own thing, and will that be disruptive? And but I've never had that experience, and people who ask me that question, it's more of a fear than actually have that happen. So I'm interested to hear that that has actually happened in your classes, that someone would come, be at the front of the room or right in the center of the room and do something completely different than what you're teaching.
Yeah, and I think in this one particular studio, it was sort of part of the culture. Like, you can do this. So
Yeah.
the teachers were, and as a newer teacher, there's a sense of I'm not sure how to handle
Mm,
this, both from the point of view of if you are doing the walk and talk, this person is in your view when you're really
mm,
trying to watch students respond to the cues you're giving for the sequence you're teaching. Um, and also, for some teachers, and as a newer teacher, I struggled with this because I wanted people to do what I was offering. And so I
mhm,
think this is a common sort of assumption that we make. And
mm,
as, over the years, as I gained more experience, I really appreciated almost for the student, let's say, who leaves. I would silently send them off with a loving wish or compassion because I would
mhm,
say to myself, I don't, in my head, as they're leaving, the early me would be freaked out. It's about me. But the now me says, I don't know this person's situation. And I hope that
mm,
they got
mm,
something out of this and I send them off with love.
mm.
So yeah, so I think I don't know how relevant this is for the listener. I do know for me it's happened and I do hear about it from teachers and I think it's helpful. I'm glad you're sharing about this because I think your perspective opens the door to thinking about these, let's just call them behaviors, but situations differently.
Yeah. Yeah. Okay. Good.
Not thinking of it as a I'm in charge and therefore what I say goes.
No, that to me, that's a deeply problematic way to be
Yeah, I
teaching.
mean, not that someone literally would say that, but
Well,
you know,
maybe.
how
I've
do
been in
yeah,
classes
maybe.
where
Yeah,
that's
but how do we
happened.
deal with the
Usually
very because
older generation teachers.
yeah, but we're teaching humans, right? And humans will
Yeah.
do what
Yeah.
humans do.
Yeah. So,
So yeah,
I'm thinking about this example where it was part of the culture of the studio, and then that comes back to this predictability thing, right? Like this is the culture, this is part of it, and maybe it's, this part of the room is, actually this is the way that I taught when we were teaching. My husband and I used to teach Ashtanga together. One part of the room we do a lead class, and the other part of the room was Mysore style. And so maybe there's a clear, this is where you do your own practice. And there's something about being in the end, like you can practice at home by yourself, right? But some people don't have the space for that. But also there's something like just lovely about being
yeah,
around people and being in a space. So if that's what you're offering and that's part of the predictability of it, then,
yeah,
beautiful.
yeah,
The different thing is if that's not part of what you're offering and someone goes rogue at the at the front of the class. If that happened to me personally, what I would do, I'd probably let it go in the class unless it was, they were very noisy or, it was really disruptive. But I would probably suggest going up to the student afterwards and just checking in and seeing, what was going on for them. And I don't know, just kind of checking in to see what it
yeah,
was. And that probably tell you something. And if they want to keep coming and practicing, in that way, you get to ascertain what's going to be appropriate for the setting, for the class as a whole. Because while we want to support an individualized practice, if there's a group in there, we need to take everybody's needs into consideration. And so maybe what they need is a private class, or maybe they want to do this, but you can make a space for them in a part of the room that isn't distracting for the other students. And maybe you name it and say, we've decided to make space for those who want to do their own practice. If any, and this is the area, if anyone else would like to join, this is where it's going to happen. And speak to it, because I think when it's not spoken to, the other students can be, look, what's going on here? Like, are we allowed to do this? And there can be this not knowing, but when we speak to it, then then the nervous system can settle because we know what's going on.
yeah. I can remember I even had a student one time who, shortly into the practice, which was a vinyasa heated flow, she was on her back. And my first thought went to something with her blood pressure, dizziness, that sort of thing. So I had them in a pose and I went over and I just sort of leaned down and I said, "Are you okay?" And she she had her eyes closed. She opened her eyes and she said, "I just got off a long flight and I realized I'm really tired."
Mm,
And I just left her. And she
perfect.
just stayed. And I was like, that is just the most fabulous response ever.
Yeah.
She came
Yeah.
with the intention. She got off the
Yeah.
plane, came to hot yoga, and then, her body responded and she did what her body wanted.
What
And
a
I was
perfect
just like,
practice. To me, that's the perfect practice, right?
yeah, I was
Yeah.
like, you're my hero. And there's all
Yeah.
these people around her, ba 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 ba. And she
Yeah.
was just chilling.
I love that. Yeah.
Yeah,
And hopefully other people in the class heard that and were inspired as well. Like that's inspiring
yeah, yeah.
because it's not easy to do that.
No. And even when you described leaving,
Mm.
get it. I mean, I can remember teachers occasionally would leave, if they left my class early, they would sort of like give me a look and they'd be like they would kind of mouth like,
Yeah.
and it would be oftentimes like they had to teach the next class, but they just
Yeah.
wanted to be sure that I didn't take it personally that they were leaving early. So they would sort of roll up their mat and, so I
Look at
totally,
what we do. Like this is like we do this. Like as a student, we don't want to put anybody or as a human, and especially women. I don't know that men do this, to be honest. We put everybody else's needs before our own. And I wanted to do that in this class. I was like, this he's a nice guy. I don't want him to get the wrong idea. He's actually a really nice teacher. And so I nearly stayed. Actually, I stayed longer than I wanted to because I didn't want to like disrupt the energy of the class or make him feel bad about himself. But in the end, like this is what I teach, this is what I talk about in counseling all the time when we say when something's like if we're saying yes to him, I'm saying no to me. And actually this class is not about him. It's about me and I'm here. And if I walk out, if I stay, I'm betraying myself. So I
right,
don't hurt him. I don't upset him. And actually what I was doing was not upsetting at all. It was putting myself first. And actually, if he knew that, I'm sure he would have celebrated that.
right. I'm just so glad we ended up here because I think it really in a way lets a yoga teacher hearing this, it's
Mm,
sort of lets them off the hook to a certain extent. I mean, yes, to what you
mhm,
said before about what role in this could I have played, which is sort of an assumption, but it still is helpful introspection to participate in. And at the same time, it does allow the teacher, I hope, to see the person, the student, as a holistic person with agency over what they do and not this energetic cord to the teacher that is an unhealthy sort
yeah.
of connection. I'd love to hear in this concept of safe space, I don't know if this falls into it, the idea of language, what we're saying. I'm sort of
Hmm.
reminded of um, I can remember occasionally in classes where I've heard as we head, especially here in Boston, everything is very seasonal. And as we head into summer, sometimes people will make comments as they're teaching about, we're heading into bathing suit season, let's do some core, that's sort of,
Yeah.
and you sort of think that's in the fitness classes, but I've heard it occasionally. And again, you can never know someone's intention behind what they
Yeah.
say. And at the same
Yeah.
time, I sort of wonder how those things land on each person. So, how does language play a role in creating a safe space for students?
I mean, language is so powerful. And I think the longer that we've been yoga teachers and the more mindful we are in the language that we use, the more kind of skillful we get in using our language. And language can be such a powerful uh, part of our teaching tool. The example that you gave is an interesting one. It's a good one. It's a focus on the body. And I think, I was having this conversation with a few people the other day. It comes up so regularly. Like, I don't know how we, grow up as humans, particularly women, but also men as well, without having some kind of disordered, dysfunctional relationship with our bodies. Like we are constantly bombarded with advertising and social media about having to look a certain way, and our value is placed on how thin we are, or our body being in, or for men it's often how muscly they are, and um, like our value is determined by how we look. And this is not one of the teachings of yoga,
Mm.
right? To have a six pack, or a skinny waist, or a tight ass, or whatever language it is. But our it can be, but it can be the reason that people come to yoga, because they want to lose weight, or they want to get strong, and that's their decision, and perfect. But what we don't want to do is use language that buys into this, I don't know what your language warning is on your podcast, BS kind of notion of our value being in the way that we look, or our body being a certain way. So we want to be very mindful of cues around that. And I would very much suggest that we leave that out, that the emphasis is more on how it feels
Mm.
and less on how it looks.
Mm.
I think all of us would benefit from that, but particularly if we have an eating disorder, or any kind of body dysmorphia, or any kind of dysfunctional thinking about our body, which I think most of it has have in some shape or form, that can be harmful.
Mm. So, one thing I'm thinking of as you're talking about this, and I'd love to get your thoughts on this, is when we're sharing cues. So, of course, we're
Yeah.
talking now about language in the context of
Hmm.
yoga. So, my
Yeah.
mind goes to what are we cueing, right? I mean, we
Yeah.
might have a conversational style where we maybe go into a little bit of conversation, but they're not
Yeah.
talking back. So it's always us,
Yeah.
always us talking. Um, and if we're sharing cues that speak to the body,
Yeah.
sometimes I think of things, and I know it's probably not a great idea to think of things in a binary way, but I think sometimes of somatic cues that are more posing an inquiry question to allow the student to have whatever experience they have. And then sometimes I hear cueing when I go to a class that sounds something like, let's say we're in downward facing dog. You should be feeling your hamstrings lengthen here. And in my
Hmm.
brain, I hear that and hear the word should, and
Hmm.
suggests that I should feel that. So my
Yeah.
logical brain goes to, but what if I don't feel that? I can
Mm-hmm.
actually say when I'm in downward dog, I really don't feel my hamstrings. Like
Mm-hmm.
I've been in so many downward dogs in my life, I feel like my body has just accepted that as just like sitting in a chair. But to someone who has never been to yoga, and in my memory of the first time I was in yoga, I definitely felt my hamstrings.
Mm-hmm.
So, talk a little about somatic cueing and I don't know what comes up for you on this so that students have agency over their experience.
Yeah. So I agree, leaving out the should word is a great idea, and not telling people how they should be feeling is a great idea. So leaving that out altogether. It's not to say that we can't point people in the direction. So many people will feel it in their hamstrings. So you might feel this in your hamstrings, or notice if you feel it in your hamstrings. And so it sounds, maybe it's just semantics and it's a bit picky, but
No, it's
actually this language can make, yeah, I can just like see what you're doing in your body there. Like it makes a difference.
such a difference.
And so we might, sometimes it can be helpful to offer instructions like that, to be specific in your hamstrings, or in your legs, or in your shoulders, so to direct people. And sometimes it can be helpful to simply notice what you're feeling. Notice when you move into this posture, into this shape, into this pose, where are you feeling it in your body? So you're not telling people where they're feeling it. You're inviting them to notice what they're sensing in their body.
Yeah.
Now, some people will love that, and some people will get lost in that. So there's an argument for not telling people what to feel at all, so not giving them any instruction about where to feel it and inviting people to feel what they're feeling. And I think people who have a high level of interoception and are able to do that. But for people who aren't aware of their body, whether they're, like me, went through a lot of university and got very kind of split off between my head and my body. It took me a long time to get back out of my head and into my body. For people who have a lot of kind of sensation in their body, whether it's from chronic pain or whether it's they have a lot of emotion that they don't want to feel, it can feel very unsafe to come into their bodies. I interviewed a woman on my podcast the other day who's a clinical psychologist and a yoga teacher, Monique Mitchelson, and she talked about autism and interoception and how autistic folk often don't have high levels of interoception, so need those specific cues to be able to feel where things feel and feel where things are in the body. So for those folk, it can be really helpful to be much more explicit about, and by explicit I mean like much more kind of clear about what you're inviting people to feel. So it might be the hamstrings, or it might be the shoulders, or the belly, or whatever it is. But still, it's not telling people what they should be feeling. It's noticing what's unfolding as sensation here, or notice what's showing up for you there.
Yeah, I love that. And I feel really good about this part of the conversation because I have coached teachers in that way, and it's nice to
Mm.
know more of the background. I have another scenario that I'd love to
Mhm.
share with you, and I know in your book there was something that referenced this in a little bit of a different context. It referenced crying in
Mhm.
respect to a student crying in a pose, but I want to just present the scenario to you, and that will lead to, I think, talking about that, because that occasionally does come up. And sometimes teachers
Oh
even
yeah, it
say,
does.
oh, if you're in this half pigeon and your eyes fill up, like, so sometimes that's even offered as a potential reaction.
Mhm.
I can remember in my very first teacher training, we did a lot of very deep work, and we were in this seated round table type conversation with about 50 teachers, and we were doing
Mhm.
really deep work, and one of the teachers started crying. And
Mhm.
the natural reaction of the person sitting next to her was to rub her back and to
Mhm.
furiously grab for the tissues. And I remember our teacher said, just leave her. It's okay that she is going through something.
Yeah.
And, as if to sort of give the suggestion to the rest of us who intuitively wanted to comfort her
Mm.
to offer this other perspective that this is healthy for this person to release this emotion.
Yeah.
And I honestly, some of these things I remember, and it's like, why does the brain remember certain things and not
It's
other things?
interesting,
Like,
right?
this is seared in my memory. And
Yeah, it was important to you.
yeah, and so I'm curious, my top line question is, if you're teaching a class and you notice one of your students is having an emotional moment, what
Mm.
might you, but it sort of relates to this story.
Yeah, yeah, great. And that's actually the sixth, the final pillar of mental health aware yoga is mental health crisis. And this happens in yoga classes. I've cried in yoga classes. I've had students cry in yoga classes. Like it happens. And it's not necessarily a bad thing either. Um, I think the tendency is to want to shut it down, and to if somebody's having an emotion, we want them to feel better, right? It comes from a good place. It also often comes from a place that we don't feel okay with somebody else having an emotion because it makes us feel an emotion and we don't really want to feel it. So often we will shut it down. And often that was the way that our emotions were dealt with when we were little, like we were rocked, or someone put a dummy in our mouth, or someone said, shh, shh, it's okay, don't cry. Like, you're feeling that, like it's a part of the way that many of us were parented. It's part of the way as a society we deal with emotion. So it makes sense that we want to kind of make it okay because, as you know, we're often not very good at showing up with emotion. But actually, for the most part, if somebody's crying in your yoga class, it's not that something's wrong, it's that they're releasing something, and we don't need to shut it down. Particularly as the yoga teacher. I think it's different if their friend's there with them and their friend wants to go and give them a hug or pat them on the back or get a tissue. Like, if that was happening in one of my classes, I would let that happen because I don't know their relationship. If I could see the person really didn't want it, I might step in and say something. But for me as a yoga teacher, I would agree. No, you don't need to pat on the back. Maybe tissues or not, that can sometimes be helpful, sometimes not. But we don't want to give our student a hug or try to shut it down, because then what we're saying really is it's not okay to have an emotion here. We're going to stop this. And so, and people can be crying for so many different reasons in our classes. They can be crying because they've just needed a big cry, but they haven't had a space for it. They can be crying because it's just so exquisitely beautiful. I've done that in a yoga class before. It can be quiet because our lives have been so busy and we haven't been able to process stuff that's been going on, and finally we have this space where we feel safe and there's some silence and some spaciousness, and finally we feel safe enough or quiet enough for something to come up, and we start crying. And actually, we don't need to be afraid of those tears. Like, these are tears that need to come up and be expressed, and how beautiful that as a teacher we've created a space for that to happen. Now, if
Yeah.
yeah, you
Yeah, I feel like that is just such exquisite, I don't want to say advice, but just guidance. And I think it's a really practical scenario that if it hasn't happened to the listener, it will
we
happen.
will.
And
I
how
think so.
wonderful that
Yeah,
you will have heard this,
yeah.
because I really think our instincts as humans are not always are not always consistent with what might make sense if we look at it through the lens of clinical psychology, right? But not everybody has that lens through which to look at things, or even just not so much human nature, just human growth and
Mm.
what is helpful to help us grow as a human being. A lot of times, like you said, the cultural impact that
Yeah.
frames how we see things, as well as our own personal, like if I grew up in a home where I was told every time I cried, like you said,
Hmm.
it's okay. Even though I wasn't raised in a house like that, when you said that, it triggered me.
I saw that.
Yeah. And I
Yeah.
was not expecting it,
Mm.
but it made me think of a child who is raised in a home where bad things are happening. And
Yeah.
that's what the parent says to the child,
Yeah.
to shift their mind to thinking this is normal. And that's what I thought of when I heard that. So,
Mm.
the piece that I'd love to
Can I interrupt you? There's
absolutely,
one more thing that I think would be helpful for people. It's okay if I
gosh,
speak to. So if a student is crying in your yoga class, so you're going to have to assess the situation. It's going to be different, in every moment. But you tune in and feel what feels right in that moment. But what might be helpful is to acknowledge the student, so the student knows that you've seen them,
mm,
and but you don't need to go in and put your hand on them or do anything like that. So it would like an acknowledgement. And if they look like they want something from you, maybe you go over and you say, is there anything I can do? So you don't need to offer anything or do anything, but is there anything I can do to help? Or you might say, crying's really welcome here. And if there's anything I can do to support you, just let me know. Yeah.
yeah, no, I love that. And I think that is like such a specific takeaway, along with when you were saying before, just shifting from should to other words that are just softer
Right.
as they
Yeah.
land on the body. So I
Yeah.
want to just take, as we're wrapping up, I want to just take one little slight diversion, but I think it's related, and I didn't think of it beforehand, but it's really coming up for me. So I want to get your thoughts on this. A lot of the work that I do with teachers in helping them build their confidence
Mhm.
is around working through limiting beliefs so that they can go into the room and teach their classes and really feel like they are qualified to be there. They have something of value to give. They don't need millions of hours of training. They don't need anybody's permission to show up authentically, right? And yet, a lot of what I hear from teachers is, especially when I work with them one-on-one, is how there's something inherent in teaching yoga that is triggering for the teacher
Mhm.
when they walk in the room and they begin to teach. And I've had teachers tell me it reminds me of when I was a kid and I had to change schools all the time and I was always that new kid. I remember a teacher telling me, my husband keeps calling me or has always called me a wallflower. And when I went to teacher training, I kept thinking to myself, who am I to think I can be a teacher? I'm a wallflower. All these things that are identity based and limiting beliefs of different kinds. And I find it, in a way, if I can just look at it objectively, I find it fascinating. But in my work with teachers to help them find their confidence, we inevitably end up talking about these things. Not that I'm digging for them, but they'll often come
They're
up.
here. Yeah.
And so I'm wondering, can you share if we sort of switch the lens from most of this conversation is about creating a safe space for the student and the lens is focused on the student. Can we
Mhm.
just shift a little bit to the lens is now on the teacher and the
Absolutely.
teacher's
Yeah.
walking in the room
Yeah.
and they've got stuff, right? We're coming in
We all have stuff.
with all our stuff. Right? I
Yeah.
typically say it's not like you walk in the room and magic fairy dust is sprinkled on you and you've reached samadhi and you're teaching your
How
class,
good would that be? Yeah.
right? So what, like what do we do with our stuff, right? But just the kinds of things like I'm
Mm,
just sort of sharing with you my non-scientific research I've been doing over the years I've been running this program where I've seen this sort of top level trend of, man, there is something about teaching yoga. It's public speaking, it's
mhm.
presenter practice that's been around for 5,000 years. It's got a
Yeah.
philosophical side, it's got a movement side, it's
Yeah.
got a yoga industry that says you need thousands of hours of training. It takes a long time to be a yoga teacher. There's do it this way, don't do it that way. It's a miracle, quite frankly, that people go in and teach their classes, right? To me, because they
Yeah.
so many
Yeah.
times say to me, like, it feels like I'm carrying the spiritual backpack with all these things that I have to be doing, and the
Yeah.
bar is way up here. And if I
Yeah.
was raised in a home where I had to get straight A's, that's the way I look at my classes. And
Yeah.
who is going to have fun teaching if you think perfection is the only way? So how can we how can we manage those feelings if we look at it through the lens of the work that you do with people?
Okay. Just a small question then.
Just yes, just a small question, right? Like I could
I
definitely
love it. I
say,
love it.
yeah,
Yeah.
just a small question. I mean,
Yeah.
obviously it's a huge question. I'll
No,
take
no, I love it.
anything.
I
I'll
was
take
being silly.
anything that you've got that you wish
Well,
to
there's a
share.
yeah, I
This,
mean, there's a few there's
honestly, I think in part, like we all should be going through therapy to work through these things in the context of being
yeah, yeah.
free as a teacher. But anyway,
Yeah.
yeah.
So, I mean, three things have come up for me as you've been speaking. And one of them, yeah, if there's these blocks or if there's these things that coming up, then this could be a beautiful invitation to go into therapy. Because any kind of new thing we do when we step outside of our comfort zone, it can bring stuff up. And therapy isn't just for when you're really significantly unwell. It can be a way to kind of move through things. So yeah, therapy might help. Um, the other thing is a piece around the nervous system because, like you said, public speaking is incredibly difficult. Sorry, let me rephrase that. It's not that it's incredibly difficult; it's that many people find it incredibly confronting. It's one of the most stressful things that we can do, is stand up in front of somebody else and speak. And, you know, I remember the first time that I started teaching and how absolutely petrifying it was. And what helped, two things helped. One was practice. And two was I did some public speaking training. I did this training called Women Speak. It's actually based out of the States with a woman called Casey Baker, but they were doing it here in my town in Australia, and learning how to regulate your nervous system and project your voice, and like imagine that you have a tail, all this kind of strange stuff. But learning how to project and to speak was incredibly helpful. And part of this training, and you don't even have to do this training to do this, is the repetition of it so your nervous system gets used to it. It kind of comes back to being predictable. The first, I don't know how long it takes to get comfortable with public speaking. It took me like many years, maybe 10 years. Maybe you can fast track it faster than that. But if you think of it through the lens of the nervous system, you have to do it enough times that your nervous system gets used to it. It's going to be pretty full on the first several, many, many times that you do it. The more that you do it, the more your nervous system settles. So when you stand up in front of 2 students, 10 students, a whole stadium full of people on a podcast where there might be thousands of people listening, that your nervous system is used to it. You've kind of built the container that you can hold that. And so thinking of it through the lens of the nervous system and understanding that repetition helps with that, I think can be really powerful. So number one was the therapy. Number two was thinking through the lens of the nervous system and getting the nervous system used to that. And number three is teach what you know. And if you're
Mm.
teaching what you know, then you're safe, right? It's when we,
You know what I say? I say when you teach from what you know, your confidence grows.
beautiful. Yeah. Yeah.
So when
When
you
we,
said
when
that, I
we,
was like, oh,
bam, there we are. But when we feel like we need to know more than we know, that's when it feels edgy and stretchy and we go into kind of a fight or flight response, right, in our nervous system. But if we stay with what we know, then we can feel confident in that. And as at the very beginning of your teaching journey, you know a little bit, right? And so you teach that part that you know. And then once you get used to that, and again, once your nervous system gets used to it and you get used to that language and sequence or whatever it is, then you add one piece to that. So you're stretching it a little bit, but you're not expecting yourself to know everything that's ever been spoken about in yoga. And I don't think anybody knows that stuff, knows all of it all at once, but we feel like we need to.
right. And I'm going to actually take it one step further into practical terms that I talk to teachers about all the time in
Mhm.
the context of so many teachers change their sequence every week because they think they have to
Mm,
keep students
mhm.
interested. And so I
Yeah,
talk with them about just from a neuroscience perspective, it's like you're going in the room every week with a brand new script, with a brand
mhm.
new sequence, and you wonder why you get so nervous. You
Yeah,
literally don't know it. And so
yeah,
all of the somatic sensations that come with going into the room, everything you're actually dealing with, and then on top of it, you know you have a brand new sequence. So this is just more
mhm.
support for the idea of teach from what you know and
Yeah,
also teach from what you love rather than what you think you
mm,
have to offer, which a lot of
yeah,
teachers will tell me, well, I go to so and so's class, she has a lot of people, and so I feel like I should be doing ABC. It's like, well,
yeah.
but that just what you said. Then you're going in and you're like, oh, I'm gonna do this thing that's really not me.
And then you're not being yourself and you're not being authentic, and people can feel that. And then they won't come back to your classes because they can feel
Right.
that. Whereas if you're
Um,
teaching, yeah, from you,
I just think that
it won't resonate with everyone, but for the people it does, they'll be there and they'll keep showing up because they feel that's really you.
right. And those are the students for you.
Totally. Yeah.
It's trying to gyrate yourself into all these different scenarios to please people. So this is where we have agency as teachers.
Yeah.
So I love that. So let's talk a few minutes about your book. Tell us what your book is about, which of course, FYI, we've been sort of touching on a lot of the key points that
Mm-hmm.
we mapped out in the beginning. So just
Mm-hmm.
tell us a little about the book and what
Mm-hmm.
we're going to learn when we read this.
Cool. Okay, so the book is called Mental Health Aware Yoga, a guide for yoga teachers. And really, it goes through the 6 pillars that I was talking about earlier in our conversation, Karen, and gives some guidance about how yoga teachers can start to support students who are experiencing mental health challenges. It really is a labor of love. I wrote this book over about a 5 year period. I'd actually written the book, and then the my publisher, who became my publisher, had heard me speak on another podcast about my work, and they emailed me and said, "Hey, have you ever thought about writing a book?" And I said, "Well, actually, I already have." So it was this kind of beautiful, beautiful synchronicity. So I ended up publishing it with Singing Dragon. It came out at the end of last year. Um, yeah, it goes into a lot more detail about what we were talking about today. I share my own story at the beginning of it. There's also some extras that people can download, different class plans and music recommendations, and some practices and things like that. If you're interested in getting your hands on a copy, you can go to my website, mentalhealthawareyoga.com/book, and there's some links there. But you can go, any kind of online bookstore, you can get it, or you can go directly to the Singing Dragon website and get it there. I have a chapter to give away. If you're interested in listening to the first chapter, you can go to my website, mentalhealthawareyoga.com/book, and you can download that for free there.
Perfect. Perfect. Well, I will include those links in the notes for the show.
Lovely.
And I just want to kind of put a bow on it here by thanking you so much for sharing your wisdom and your knowledge. I love leaving these things with a little bit of structure and who knows where it's going to go. And I just really feel like we touched on so many things that are going to be of value. So I just thank you so
Mm,
much for
you're
the.
so welcome. And actually, this interview felt a bit like a mentoring session. So I often mentor with psychologists and yoga teachers, and they come with just like the questions that you had then, and we explore them together. So it was a real kind of joy exploring those questions with you.
Yeah, like I said at the beginning, I have not taken a dive into these areas. So this was really, really fun to do this. Maybe we can consider like a part two or an Instagram live or something where we can, because I'm even thinking now that we're on a roll, oh, I didn't get to ask her about this or that. Uh,
Oh,
and I think there's
I love
just
that,
so
Karen.
much here for not just the lens on me, but the lens on my students. So it's sort of a win-win to go into these conversations. So thank you so
My pleasure. I'm glad we did
much.
it.
Yeah, and this is going to go live. We're sitting here on June 2nd. This is going to go live on June 16th. So maybe like a week and a half or so, 2 weeks, and it'll be up and running. And
Fantastic.
I'm just going to have you hang on. I'm going to end our recording and then I'll just
Uh-huh.
do a little bit here. So to the
Great.
listener, we'll see you soon.
Thanks for having me.